In Chapter 5, we will be going over the integumentary system, which is the most superficial and visible organ system in the body. The integumentary system includes the skin and its derivatives, such as nails, hair, and cutaneous glands. It has five main functions, and the first one is maintaining the body's integrity. What that means, it's basically the skin and the integumentary system is the first line of defense of the body. It's resistant to a lot of trauma and infections, and it bears the most force of the physical trauma to the body. Next is maintaining temperature. So it does that by acting as a coat when you're cold to keep the heat inside of the body, and as a radiator to lose heat when you're hot. The other function is absorbing sunlight, and it does that for uh, so it can convert the inactive form of vitamin D to its active form. So the skin and the integumentary system carries out the first step of producing vitamin D. Next is providing sensory information, and we talked about that a little bit in the last chapter. The skin is equipped with a lot of nerve ending to sense for heat, cold, so temperature, pain, vibration, and other sensation as well. And you find a lot of these nerve ending on the palms, the tips of the fingers, lips, face, nipples, and genitalia. Finally, it maintains, or last but not least, it maintains homeostasis, and it does that by separating the external environment from the internal environment and having them to be heavily regulated. Once again, the integumentary system consists of the skin and its derivatives, and the word integument, it means specifically the skin that is covering the body. So the skin that you see, this is known as integument, and the another term for it is known as the cutaneous membrane. The word cutaneous means surface, so it's the surface membrane. Another word for the skin is derm. So as the scientific study of the skin and the integumentary system and how to treat it is known as dermatology, and an expert in this field is known as a dermatologist. Another thing that is important to note is the skin covers about 1.5 to 2 meters squares of the body, and it accounts for about 15% of the body weight, which is quite a bit, and a lot of people don't know that. The thickness of the skin is going to depend on the location. So the skin at the bottom of the feet is a lot different and a lot thicker than the skin of the face. The skin is composed of three different layers. The first one is the epidermis. Epi means above. The epidermis is made up of stratified squamous epithelium. We learned about that in the last uh, lecture. So stratified means two or more, squamous means flattened. So the epidermis is made up of many layers of flattened epithelium cells. Next layer is the dermis, and the dermis is the layer that is deeper to the epidermis. It's composed of irregular connective tissue, and the reason for the irregularity is because the dermis is getting pulled in all different directions. Next is the subcutaneous or the hypodermis layer. Hypo means below. Uh, Other people call this layer as sub-Q, so sub-Q, even though there is no Q in the word subcutaneous. Technically, this layer is not part of the integumentary system, but since it's closely adhering to the dermis, we're going to talk about it here. This layer is made up of areolar and adipose connective tissue. This picture is a general depiction of the skin structures inside of it and the different layers. As you can see, the layers are the epidermis, dermis, and hypodermis. But very important to note, the dermis layer is actually the thickest layer out of the three. In here you can see different pictures of the skin. So on the top left, it's a microscope image of the skin, so you can see the epidermis in comparison with the dermis and how the dermis is much thicker. Down below it, it's a micrographic image also of the skin depicting the epidermis comparing with the dermis. At the top right, you can see the different layers of the epidermis, and we'll be going over that. This is also a micrographic image. And at the bottom right, this is fingerprints, and you can see how the epidermal rings and the epidermis are shaping these structures. The epidermis is made up of many cells, and we will talk about three of them in here. The first one is keratinocytes. So whenever you see the word cytes, that means cells. So keratinocytes, they are cells that produce a tough, strong, fibrous protein known as keratin. Keratin, once again, is a strong, tough, uh, durable, waterproof protein, and the goal of it is to protect and resist physical trauma. So keratinocytes, they produce keratin, which protects the body and the skin and makes it more durable. The next type of cells is melanocytes. So they are cells that found in the deepest layers of the epidermis, and people with darker skin, they have more active melanocytes, while people with paler skin, they have less active melanocytes. Melanocytes, they produce a pigment that protects the body from UV light, and this pigment is melanin. Uh, so, uh, Melanin plays a key role in protecting us from the sunlight. The last type of cells that we can look at in here is the tactile epithelial cells, and these are cells that sense the mechanical changes in the skin, so it provide the touch sensation to the body. So in here we see the different layers of the epidermis, and we will talk about this in the next slide. But on the right image, we can see that some of the cells we talked about in the previous slide. So we see keratinocytes here, right here as well, and as well as right here. So we can see that keratinocytes are found throughout the epidermis, while melanocytes, they are only found in the deepest layer of the epidermis. And we can see also tactile cells and tactile nerve cells right here. The epidermis is composed of 4 to 5 different layers or zones. The reason I say 4 to 5 is because the presence of this layer or zone, stratum lucidium, is going to depend on the location. So in places where there's thick skin, stratum lucidium is present, while on the other hand, in places where there is thin skin, stratum lucidium is most likely not present. So these layers, from deepest to most superficial, they are stratum basalis, stratum spinosum, stratum granulosum, stratum lucidium, and stratum corneum. What happens with these cells when they go from deepest to most superficial is they're going to replace their uh, living inside structures with keratin, that tough, strong, fibrous protein we talked about. And as a result, they're going to become dead keratinocytes. So we can see that there is a nucleus in stratum basalis, spinosum, and granulosum. But as we progress to the last two layers, lucidium and corneum, that nucleus is not present, and it's just a dead keratinocyte. A helpful way to remember these layers from deepest to most superficial is big special green lime cupcakes. So the word basali is associated with bake, spinosum for special, granulosum for green, lucidium for lime, and corneum for cupcakes. And here's a picture for you of this special green lime cupcake. On the left side, you see a real picture of the skin and the different layers of the epidermis, while on the right side is a depiction. So you see the different layers of the epidermis from deepest to most superficial are stratum basale, stratum spinosum, stratum granulosum, stratum lucidium, and stratum corneum. And you can see, as we mentioned earlier, that in the first three layers, you can see prominent nucleus throughout these cells. But once they get to the last two layers, so stratum lucidium and corneum, that nucleus is gone and it has been replaced with keratin. And the word stratum, by the way, or strata, it means layer. Stratum basale is the deepest layer of the epidermis. The easiest way to remember that is when you associate the word basale with basement. So stratum basale is one layer thick and it separates the epidermis from the dermis. What happens in this layer is there is a lot of stem cells that give rise to new keratinocytes. And once the keratinocytes are produced, now they migrate their way up from the deepest layer, once again, stratum basale, to the most superficial. So in this layer, there is a lot of cell division and turnover. Once cells are produced in stratum basale, they move their way up to stratum spinosum. So stratum spinosum is the layer that contains the daughter cells of stratum basale. Next, the cells make their way up to stratum granulosum, and stratum granulosum is an important layer because this is where we see keratin being produced for the first time. Once keratin is being produced, that's going to cause the organelle and nucleus to die and disintegrate. The cells are still living in this layer, so once again, stratum basale, stratum spinosum, and stratum granulosum have living keratinocytes, but once the cell is fully keratinized, the cell is dead, but thanks to keratin, the structure is still maintained. Stratum lucidium is the layer that contains dead keratinocytes. So this layer can only be found on thick skin within the palms of the hand and the soles of the feet. This layer gives extra protection to the skin in these areas from UV light. And as a result, it's very uncommon and rare to have the palms and the soles get sunburned. This layer also called lucidium because once it's stained, it's actually translucent or clear in color. The last zone of the epidermis is stratum corneum. Stratum corneum is about 20 to 30 layers of dead cells. They are cells without a nucleus, so anucleus cells, and they are tightly and closely packed to one another. The reason for that is so they can prevent microorganism growth between them, because you don't want bacteria or fungi to grow between these cells. Once they make their way in stratum corneum, they remain there for about 2 weeks. Then they are sloughed off. So the life cycle of a keratinocyte from once they are produced in stratum basale all the way to stratum corneum, it's about 2 weeks. Then they remain in stratum corneum for 2 weeks. So as a result, they have a life cycle of 1 month. Now here is a quick comparison between thick and thin skin. So thick skin can be found on the palms of the hands, the soles of the feet, and lining also the surfaces of the fingers and the toes. Thick skin has all 5 layers of the epidermis, so it contains stratum lucidium. It's obviously thicker than thin skin, that's why it's called thick skin, and it has sweat glands. So if you notice, the palms of your feet, the palms of your hands, and the soles of your feet They sweat, but they do not have hair follicles or sebaceous glands, so they don't grow hair and they don't produce oil. On the other hand, thin skin is covers most of the body, and the most important thing about thin skin, it lacks stratum lucidium, so it only has four layers. So uh, it has stratum basale, stratum spinosum, stratum granulosum, and stratum corneum, but it doesn't have stratum lucidium. It has sweat glands, hair follicles, and sebaceous glands, and it's thinner than thick skin. Here is a quick comparison between thick skin on the upper left and thin skin at the bottom right. So we see that in thick skin there is stratum lucidium. So on the other hand, in thin skin, stratum lucidium is not present. But if we look also and compare stratum corneum, we can see that stratum corneum in thick skin has a lot more layers, while the stratum corneum in uh, the thin skin is far thinner and has less layers. The epidermis color comes from three pigments, which are melanin, keratin, and hemoglobin. First of all, let's start with melanin. Melanin is a pigment that it comes in black, brown, tan, or yellow brownish in color. Uh, Melanin, as we mentioned earlier, is produced from melanocytes, and basically, we have about the same number of melanocytes. The only difference when it comes to uh, why some people are darker or lighter in skin is due to the melanocytes themselves and how active they are. So a person with a darker skin have a more active melanocytes, while a person who is more pale, they have less active melanocytes. The other pigmentation is uh, hemoglobin, and hemoglobin is a protein that binds oxygen in red blood cells. It gives the blood its reddish color, and we can see the color of hemoglobin around and in the lips because the capillaries of the blood vessels come very close to the lips. So that's what gives the lips the pink slash reddish color. The other type of pigment is keratin. Keratin is a yellow to orange-ish pigment. It can be acquired from egg yolks, from orange and yellow vegetables such as carrot, corn, squash, tomatoes, and others. Keratin plays a role in giving the fat its yellowish color because keratin is usually stored in the adipocytes. So as mentioned, we have about the same number of melanocytes. The only difference when it comes to skin color is how active the melanocytes are in the stratum basale. So right here on the image on the left, we see a person with darker skin who have a more active melanocytes, which gives the skin its darker color. On the other hand, the picture on the right, we see barely, if any, melanocytes that are active. In the clinical setting, experts use certain terms to describe what the skin color is looking like and what might a person be experiencing. The first one is cyanosis or kinosis. Usually it's pronounced as cyanosis. Cyanosis is a blueness or in the skin or a skin that is bluish in color. Usually that's due to the lack of oxygen in the circulatory system. So hemoglobin, once there's no oxygen bound to it, over time it's going to turn into uh, yeah, over time it's going to turn into violet to reddish in color, and on someone's skin that's going to translate to blue. Usually the lack of oxygen is due to some problems with the circulatory system. Erythema, on the other hand, is a term used to describe abnormal redness of the skin. It means an increased blood flow to the skin, and we can see that in situations such as exercise, if you're feeling warm or hot, also in situations such as embarrassment and anger, and we can see that the skin is more reddish in color. Some people may describe it as blushing. Paler or pallor, this is basically a way to describe the skin that is pale or ashen in color. Uh, what that means usually it's reduced blood flow to that area, and it could be from just extreme cold weather or from a person who's experiencing a shock. Albinism is a way to describe the color white. Alba means white, and basically these are individuals who have a genetic lack of melanin, so their melanocytes are not active. Jaundice, on the other hand, it's a way to describe people or somebody who may have or may be experiencing some liver problems, and usually they are turning yellow in color. Uh, so the main reason for jaundice is the accumulation of bilirubin. Bilirubin is a product from of the breakdown of hemoglobin. So once the hemoglobin goes to the spleen and the liver, then it's broken down there, and bilirubin comes as a byproduct. So if the liver is experiencing any issues, or if there is some type of issue when it comes to getting rid of bilirubin, bilirubin is going to accumulate in the body, and as a result, turning a person into uh, yellowish in color. Hematoma is is the scientific way of describing bruise, and it's basically a clot of red blood cells in an area, and usually bruise change in color depending uh, on the time of the injury and how long they have been there. Here are some additional skin markings. The first one is nevus, which is the scientific name for mole. They are an overgrowth of melanocytes, and usually they are harmless. Freckles, they are similar to nevus, but they are flat, melanized patches. They are present in localized area due to the increased activity of melanocytes, and freckles vary due to the exposure to the sun and heredity as well. Hemangioma, they are discoloration of the skin due to tumors in the blood vessels, and these tumors are usually benign. There are two types of hemangiomas. The first one is capillary hemangiomas. They appear as nodules at birth, and they usually disappear 1 month after birth or a little later in the childhood. They're also known as strawberry birthmarks. Uh, Cavernous hemangiomas, they're also known as port wine stains, and the reason for that you'll see on the next slide is because it looks like somebody poured a glass of wine on someone's skin. They are usually present at birth, but they disappear once a child reaches the age of 10. In some cases, in most cases, they digress. So in 90% of people, they disappear, but 10% of people, they have these cavernous hemangiomas. Unfortunately, they enlarge and increase. And here are the two different types of hemangiomas. On the top left, you can see the capillary hemangiomas, and at the bottom right, you can see cavernous hemangiomas. The next layer of the skin we will be talking about is the dermis. Once again, the dermis is the thickest layer of the skin. It is very rich in blood supply. This is where you find the hair follicles and the root of the nails. The dermis is divided into two divisions. The first one is the papillary division or layer. This is the division that is deeper to the epidermis, but it's the most superficial one of the dermis. It makes about 20% or one-fifth of the dermis size, and it is very rich in blood supply. The next layer is the reticular layer, and the reticular layer is the major portion of the dermis. It makes about 80% of the dermis, and it's mainly made of the dense irregular connective tissue we talked about earlier. And the reason for that, it's because this layer is the one that help the dermis get pulled in in all different directions. Next, we'll be talking about the epidermal ridges, and those they develop in utero. They are basically the dermis and the epidermis. They come together in a puzzle fashion, and they develop what is known as fingerprints. So fingerprints they develop in utero. Here is a micrograph image of the dermis. We can see the papillary layer. There's a lot of irregularity in this layer, and kind of the same deal with the reticular layer in the picture below, with these rope looking like structures. Uh, Overall, the dermis is very ununiform and irregular. In this image, you see the different layers of the skin, and that the dermis is the thickest layer of it. The reticular layer is the major portion of the dermis, and the papillary layer is the most superficial one. We also see the epidural ridges we talked about. They are the extension of the epidermis coming together with the dermis to form fingerprints in a person. The next layer we will be talking about is the hypodermis, also known as the subcutaneous layer or sub-Q. It is not considered to be part of the integument, but it's useful to talk about it in here because it's just really adhering to the dermis. There is also no defined line between sub-Q and the dermis, but usually the sub-Q has more areolar and adipose tissue. The hypodermis or the sub-Q layer has some important functions such as protecting the body, and it acts like pads. It's also a very important energy reservoir because this is where a portion of the adipose tissue is stored. Also acts like an insulator from the heat. Shots and uh, medications are usually given in here, injected in here, and the reason for that it's because this layer is highly vascular and the body will absorb them quicker. There is difference in the thickness and the distribution of this layer when it comes to men versus women. Women generally, in general, they have thicker uh, subcutaneous layer, and you can see that mainly in the breast, buttocks, hips, and the thighs. For men, it's usually a thinner layer in comparison with women, and usually you can see them. You see this layer a little bit more in the neck, upper arm, abdomen, lower back, and the buttocks region. Now we will be talking about some accessory structures of the skin. There are three of them, which are hair, nails, and cutaneous glands. First, we have hair, and the hair is almost found everywhere on the body, with few exceptions. So, we talked about some of those exceptions earlier, and those are the palms of the hands, the fingers, also the sides and the soles of the feet and toes. We also don't see any hair on the lips, and also there's no hair in portion of the external genitalia. Hair composition is basically composed of keratinized cells that growing in a cylindrical fashion. So that's what gives rise to the hair. And a single hair, is known as pilus. Group of hairs is known as pili. Even though a lot of people like to shave or wax their hair, believe it or not, it has some very important functions. The first one is protection. So the hair protects the body and covers it from sun rays, as a result, protecting the skin from sunburn and excessive damage to it. Also, you can see that there is more hair around certain openings of the body, such as the eyes, the ears, and the nose. Also, another function is heat retention. So the hair prevent the loss of heat from the body, so it acts as an insulator. Also, the hair's follicles have tactile receptors and nerve receptors associated with them to sense light touch. This is really important to sense if you have anything on your body. The hairs really are helpful to provide sensory information and sensory reception for our bodies. Also, another thing is visual identification. We use the hair on someone's head to determine the age, the sex of the person, and also individual specific individuals, and differentiate people from one person to another. Another function that is probably not known for most people is hair is used for chemical signaling, and the hair releases pheromones. Pheromones are chemicals that are released by specific and certain sweat glands found in the axillary and the pubic region. So once a person hits puberty, the hair follicles start releasing pheromones, and sorry, the sweat glands on the hair, they start releasing and secreting pheromones. And this chemical signaling is uh, important and has been used in attracting sexual partners. So a lot of people in uh, who might be attracted to their partners, uh, one of the possibilities is they are attracted also to their pheromones. The hair is divided into two parts. The first one is the root, and the other one is the shaft. So the root is the part that is in the skin and deep to the skin surface. The shaft is the portion of the hair that extends beyond the skin, so it's what you see of your hair. In the root, you can find the bulb, and basically, this is where the hair originates, and it's found in the dermis. Next to the hair bulb, you find the hair matrix, and this is where the new cells are being produced, and uh, the cells gradually get pushed further toward the surface and extend uh, beyond the skin. You also see a tube that surrounds the hair root, and this tube is known as the hair follicle. Right, also attached to the and right next to the hair, you see a muscle, a smooth muscle called erector pili, uh, attached to the hair follicles, and the goal or what these hair do is they elevate the hair, and they raise it in situations when there is a stimuli such as fear, when someone is cold, and they create what is known as goosebumps. Goosebumps, we know they are there, but we don't know what's the function of them. On the left side, you see an illustration of the hair. So you see the hair shaft extending beyond the skin surface. You see the hair bulb right here, and on top of it, the hair matrix. You also see the erector uh, muscle, and you can also see the tube surrounding this hair. This is the hair follicle. On the right side, as a micrographic image of the hair. So once again, this is the hair bulb, and right there you see the hair matrix. This is where new cells are being made, and this is the hair follicle tube right here. There are three different types of hair we will be talking about. The first one is lanigo. Lanigo is a fine downy hair, usually unpigmented. It can be found in developing fetus, specifically at the last or third trimester, and usually by birth, being replaced by the vellus hair. Vellus hair is also fine hair, similar to lanigo. It's usually can be found on the upper and lower limbs. So the hair that you see on your forearms or your legs, this is considered to be vellus hair. The third type of hair is terminal hair, and terminal hair is usually longer, coarser, and it's pigmented. It can be found basically on your eyelashes, in your eyebrows. It's the hair that forms the hair on top of your head and the men's beard. Also, in some cases, it's the hair that can be found on the men's chest and trunk region. It's also can be found and develop uh, once a person reaches puberty, and what happens is the hair in the axillary and the pubic region is being replaced from vellus hair to terminal hair. Similar to skin color, the color of the hair is the result of melanocytes producing melanin. So melanin is the thing that gives hair its color. With age, the hair becomes lighter in color, and that's due to the decrease of the activity of melanocytes and the production of melanin. Hair loss is also something common. Uh, on regular daily basis, we lose between 10 to 100 hairs per day. You don't need to know the numbers, but just know it's something normal. Hair loss can also may be the results or can be increased due to uh, uh, taking new medications or drugs, maybe changes in the diet, the presence of radiation, stressful situations. So, stress actually increases hair loss. So, try to be as relaxed as possible, otherwise, you're gonna lose your hair. And also, situations such as sickness. So, high fever can also increase hair loss. In other cases, you've got pregnancy, and post pregnancy can also increase hair loss. Thinning of the hair is something common, and it's called alopecia. You can see it in both sexes, but it's more common in men. And overall, in some situations, it can lead to male pattern baldness. The next derivative of the skin we will be talking about is the nail. So, nails are made of uh, keratinized epidermal cells, and these cells are densely compacted to one another, forming the hard structure of the nail. Nails can be found on the dorsal edges of the finger and toes. So remember, dorsal means back. So basically, from an anatomical position, the palms are anterior, and the back of your hand is posterior, making the fingernails on the posterior side of the hand or on the dorsal side. Also, the nails are found on the distal tips of the digits. Next, let's talk quickly about the structures of the nails. So then there are three main structures for the nails. There's the free edge, which is the part that's sticking out of the nail. There's the transparent nail body or plate, and it's you can see it right here in this image. And this is the free edge up there, and also the nail root, and the nail root is embedded in a fold of in a fold of skin. On the nail body, you can see a white crescent called lunula, and it's at the base of the nail. Uh, the root of the nail is covered by a band of skin, and this is this band is known as the epinicium or cuticle. And here is a sagittal cut of the finger. We see the free edge sticking out of the nail, and this is the part of the nail that you clip off. We also see the nail body, the lunula, which is a group of connective tissue, the epinicium, or the cuticle, and this is the seal that forms on top of the root to make sure that there are no microbes or microorganisms just going in there. And the nail root is the part that's embedded in the skin. You can't see, but this is where new cells are being made. The next derivative of the skin we will be talking about is the cutaneous glands. We will be talking about four different types of glands. The first one is sebaceous oil glands. Those are associated with hair follicles and they secrete a substance known as sebum. These oil glands or sebaceous glands, they are found everywhere in the skin except areas of thick skin such as the uh, palms of the hand and the soles of the feet. But they can be found more commonly on the face and in the scalp. So in the face, they're unfortunately in some cases they're going to create pimples and zits, which is something that people don't like. But on the scalp, the those sebaceous glands have very important function of releasing sebum, which is going to keep the hair soft. Another function for these sebaceous glands and sebum specifically is before showers were a common thing, and for a matter of fact, showers were and bathing was not something that's very common throughout the human history. We had to rely on these sebaceous glands and sebum to keep us clean for the most part and protect us from microbes. Eccrine sweat glands, they are glands that release sweat and they are the most common and numerous in the skin. Uh, the goal of releasing sweat is to decrease body temperature and keeping the body from overheating. The next uh, gland is apocrine gland, and those are located in the axillary and the pubic region, and they are not active until somebody has reached uh, puberty. Ceruminous glands, they are uh, located in areas such as the ear canal, and they secrete a substance known as uh, cerumen. Cerumen is basically the scientific word for earwax, and it has important function such as keeping the ear waterproof. It also prevent the growth of microbes inside the ear canal and overall protecting the ear and keeping it safe. Let's talk quickly about wound healing. There are two kinds of wound healings. The first one is epidermal, wound healing, and the second one is deep wound healing. The epidermal wound healing is a pretty fast one because the damage has occurred to the epidermis, so usually it's a pretty fast recovery. In comparison, the deep wound healing, on the other hand, it takes a lot longer because the damage is not just uh, in the epidermis, but it extends to the dermis and in some cases into the hypodermis. Let's talk quickly about the stages of wound healing. The first stage is the blood vessels are going to bleed into the wounds, and that's going to bring white blood cells, so leukocytes and fluids into that area to clean the cut. Once the first stage is done, then the second stage is going to occur, and that's going to be the formation of blood clot to stop the body from losing more blood, and leukocytes are now present to clean the wound. Next is going to be the regeneration or regrowing of the blood vessels, as well as granulation tissues are being formed. So basically, this is new tissue is being formed and added. Once the deep part of the cut has been healed, now the epithelium is going to regenerate and connective tissue is going to also regenerate, causing fibrosis. The wound healing is going to depend on the type of the cut and the depth of it, and the length as well. So it's not rapid, it's going to take a while for a wound to heal, and again, it's going to depend on the depth and the width of the cut. In severe damage cases, the most likely the original condition of the skin cells and the skin is not going to return. And as a matter of fact, even if it's a small cut, and even if it looks it has been healed completely with the naked eye, if you take that tissue under the microscope, you're going to see scar tissue in that region, and that this tissue is not the same it once used to be. So here are the four stages of wound healing in an image form. So stage one, the cut has been made, and the blood vessels are bleeding. Stage two is forming the blood clot, and we see the white blood cells are gathering in that area. Step three is the regrowing of blood vessels, and we see the granulation tissue are trying to repair the damaged area. And stage four is the regeneration of the epidermis, and we see also connective tissue forming fibrosis, or a scar. Aging is going to have its effect on the skin, so we see wrinkles being developed as a person gets older. The skin is far more prone to dehydration and cracking. As a result, we see sweat glands are not as active as they used to be, so there's a decrease in sweat production. There is also a decrease in the number of melanocytes and the melanocyte activity as well. Uh, so that's going to result in gray hair and ununiform skin pigmentation. Sebaceous, the sebaceous layer is going to be lost over time, and that's going to decrease the thickness of the skin, and as a result, elderly people are far more prone to being cold and cold weather. Nails are going to become more brittle with age because these tissues are not as strong or as useful as they once used to be. Inactive people, and especially once they become older, they become more susceptible to something known as pressure ulcers or bed sores. Though this is basically a situation where the skin is not being used and there is a physical pressure on that area of the skin going to cause it to break down and die. And in this picture, we see a pressure ulcer on someone's heel. Skin cancer is one of the most common cancers out there, but it's the easiest to treat if and only if it's detected early. It has a very high survival rate if it's been detected and treated early. Usually, skin cancer is caused by an excessive exposure to UV light, so exposure from the sun or tanning beds. So please make sure to wear your uh, sunscreen whenever you go out. And in my opinion, don't use tanning beds. The risks outweigh the benefits. There are three different types of skin cancer. You've got basal cell carcinoma, squamous carcinoma, and melanoma. And in this image, we see a picture of melanoma. Burns are usually physical damage to the skin, and that occurs due to excessive exposure of heat, electricity, so a shock, UV radiation, some chemicals spilling on the skin, such as strong acids uh, or other types of damage that's going to cause the skin to burn. There are three different degrees of burn: first degree, second degree, and third degree. And that's going to depend on the area of the damage. So, first degree burn, it's damage to the epidermis. So, in this picture, we see damage to the skin. So, the skin is red in color, and in some cases, there is a little bit of edema. Second degree burn, on the other hand, it's not just damage to the epidermis, but it's also damage to the dermis. So we see in second degree burns blisters that are white or gray or red in color, and they can be pretty painful. Third degree burns are the leading cause of accidental death in the United States, and that's basically a complete damage to the epidermis, the dermis, as well as the hypodermis in some cases, and in extreme cases, even damage to the muscle and the bone tissues. And basically, all these tissues that I mentioned, they have been completely damaged. So, since the dermis is gone and damaged, the skin cannot regenerate only from the edges of the burn. So, in third degree burns, to ensure the skin regeneration, uh, skin grafts are required for that person to regenerate skin and overall survive. Because with burns, if the skin does not regenerate, then microbes are going to enter the bloodstream, and overall, the body is not going to be able to fight uh, the microorganisms for a long periods of time. Fun fact: I actually once had someone spilling sulfuric acid on me, but thankfully that acid was neutralized. So I just ran my forearm under the water, and some way, somehow, I did not get any damage. Here is a fun fact: Botox is used to treat wrinkles, and we got Botox from certain bacteria. Right here is the name of the bacteria, and we basically took the toxins of that bacteria and cleaned it and made it into Botox. So what Botox does, it blocks the nerve impulses to the facial muscles to prevent facial expressions. As a result, it's going to lead in decrease in facial muscle activity, and that's going to give the illusion of decreased wrinkles. It's a temporary effect, and it's going to last between 3 to 6 months, but you can take Botox for a long periods of time, and that's what a lot of celebrities do to just appear younger.